Hello everyone. I am Dr. Drissi Oudghiri Meryem from Morocco. So I'm a resident doctor at the hospital Sheikh Khalifa, and I'm studying at University Mohamed VI of Health Sciences. I am at last days of medical residency. So I'm talking about a study that we did in our hospital about impact of fasting during the month of Ramadan on the therapeutic balance of patients followed for hypothyroidism. So we know that hypothyroidism is a chronic pathology who necessitates long-term treatments with the particular modalities of intake. So we have to take the treatment and wait at least 13 minutes to eat the breakfast or the meal. And it would be a problem of a bad compliance. So Ramadan fasting is allowed to patients who are treated for hypothyroidism. Patients with primary hypothyroidism need to take levothyroxine replacement. And we have to respect the interval between the treatment and meal, and this could be difficult and impact the hormone balance. So the aim of our study is to investigate the impact of fasting during the month of Ramadan on thyroid hormone balance in patients with hypothyroidism under levothyroxine. So about patients and methods, our work is a prospective comparative study that includes patients with hypothyroidism who are taking levothyroxine. So the primary criteria was euthyroidism in pre-Ramadan. So we take only the patients who are stable. And we initially do a consultation conventionally in the hospital. And after, we continued our work with the telephone calls. We also evaluated the therapeutic compliance based on the Moresky questionnaire. And we excluded patients who are under hypothyroidism secondary to thyroidectomy for cancer, because the objectives of TSH is not the same. So we collected 65 patients. The sex ratio was 10, so 10 women for men. And obviously it is known that hypothyroidism is more seen in women than men. The mean age was 50 years old. So the average age of the pathology, is 6 years. Almost 50% patients was treated for Hashimoto thyroiditis, and 43% was treated for hypothyroidism secondary to thyroidectomy, but not for cancer. And the other one, so 5% was treated for iatrogenic hypothyroidism or non-autoimmune thyroiditis. So our patients are followed up for other chronic pathologies in 27% of cases. And it can be a cause for a bad compliance because they are taking a lot of treatments. Our patients were good therapeutic compliance in 83%, poor therapeutic compliance in 4%, and average in 13%. So our group was a good therapeutic compliance. We lost sight of 13% patients. At Ramadan, so 51% patient was taking the treatment before the fasting meal, and 49% was taking the treatment before the dawn meal, so at suhoor. The respect of the half-hour interval was in 64% only. So after Ramadan, we did the test for to see who are in euthyroidism. So 85% of patients remain in euthyroidism. 8% had hypothyroidism, and 7% had hyperthyroidism. And for these patients, we proceeded to a therapeutic adjustment. We noted a skip in taking the treatment in 5% of the cases, only 2 or 3 days in the all months of Ramadan. So in conclusion, hypothyroidism is a pathology more common in women. If well managed, there is no problem and no disability in daily life. Fasting during the month of Ramadan is allowed provided that there is a good follow-up and good therapeutic compliance. In our group study, TSH levels were not significantly changed, which is similar to some studies in literature. To conclude, Ramadan fasting does not cause any need for change in dosage of levothyroxine in hypothyroid patients.